My name is Mark Funkhauser, and I'm a site manager with the National Council of Juvenile and Family Court Judges. I'm helping to facilitate today's presentation with my colleague, Andrew Wachter, who I'll allow to introduce himself now.
Sure, thanks, Mark. My name is Andrew Wachter. I also am a site manager with the National Council's Child Welfare Department. My role is primarily assisting juvenile and family courts across the country implement the best practices that are outlined in our enhanced resource guidelines. And on occasions, I get to participate in great webinars like this one today. So thank you all for joining us.
Thanks, Andrew. The National Council of Juvenile and Family Court Judges, with support from the State Justice Institute, is hosting a series of 5 webinars, Opioids in the Courts and Difficult Conversations. We've already completed 2 webinars so far, one on prevention, one on intervention and treatment. Future webinars will include conversations on reducing overdose and death, and then finally one on recovery. This webinar is the 3rd of a series, and we explore challenges here associated with harm reduction in dependency and delinquency cases in family courts. We would also like to thank our primary funder and partner on this project, the State Justice Institute. SJI has a long history and mission of providing support to improve the quality of justice in state courts, along with fostering innovative and effective solutions to common issues faced by all courts. I'd like to go over some of the learning objectives today. Number 1, we want to understand the concept of harm reduction as it applies to substance use disorders. 2, we'll understand the role of courts in development of an effective continuum of services, including harm reduction strategies. And finally, we'll be talking about how to apply those principles of harm reduction to juvenile and family court cases. So we're talking about harm reduction in the context of both dependency and delinquency. We will be highlighting examples that are specific to opioids and broader issues and concerns. We will explore challenges associated with referring children and families to services in dependency and delinquency, and how the courts and other agencies and service providers can work together to meet the needs and improve the lives of children and families. The value of harm reduction in the community cannot be overstated, especially as it relates to the challenges courts face when there is not a significant collaborative network with viable alternatives for harm reduction to support people from unnecessary, deeper involvement in the system, including removal of children or detention for juveniles and placement, and then residential services, and even treatment for adults. We must also mention the integral connection between harm reduction and the rest of the continuum as we do this series. Courts, judges, and communities need resources and support as they do not operate in a vacuum, and they cannot do it alone. This comes through a serious focus on trust and community relationship building, and getting creative in the development, implementation, and sustainability of programs and services and resources. So today's format will be, Andrew and I will be the facilitators, and the purpose of this panel discussion is to cultivate the expert input from our panelists that leads to more effective use of harm reduction in juvenile and family courts. We will be asking questions, and the facilitators and as the facilitators, and panelists will comment on the feedback and given from the online participants as we share innovative strategies. Next, I would like to welcome and introduce our panelists from the Pueblo of Pojoaque Tribal Court in northern New Mexico today. And I'd like to ask you to briefly introduce yourself, your current work and background. We'll start with Judge McGinnis.
Hi, I'm Kim McGinnis. I'm the judge at the Pueblo of Pojoaque. I've been the judge since 2013. So we've been on quite a journey towards harm reduction and becoming a trauma-informed court. I have my PhD is in neuropharmacology. So before I became an attorney, I got a PhD from the University of Michigan in neuroscience. And so I was a neuroscientist before I became a judge. So I talk a lot about the brain with my staff, and that's a lot of where we start, is what's going on in the brains of the parents and the juveniles who are in the court system and caught up in the court system.
Thank you, Judge. And Jill?
Good afternoon, everyone. My name is Jill Campoli. I'm the Behavioral Health Clinical Director here for the Pueblo of Pojoaque, and I've been serving and working with tribes in northern New Mexico since 2014 and have a specialty with trauma and have training as a certified clinical trauma professional and training with trauma-informed care. And I've had the pleasure and privilege of working for the Pueblo Pewaukee since 2019 and helping oversee the services here for families and juveniles in the Tribal Healing to Wellness Court since then.
Thank you, Jill. And then finally, Dawn.
Dawn, you're on mute.
My name is Dawn D. Smith. I'm the probation officer. Technically, I am the compliance officer for the Pueblo Pewaukee. I have been with the Pueblo since 2014. My prior experience is in law enforcement. I was a police officer for almost 20 years, and I was also a child abuse investigator. So it allows me to have a very diverse understanding of people. I do a lot of the basic work for the probation office, including pre-sentencing investigations and assessments.
Thank you, Dawn. And today, our panelists will be answering questions relating to the topics of harm reduction here, and I'm going to transition this to Andrew so he can set the stage and give us the background for this project on resource mapping and planning. Andrew?
Thanks, Mark, and thank you to the panelists for joining us this afternoon. I thought I'd take a few minutes to sort of set the stage and talk a little bit about how we ended up creating this series of webinars based upon some other work that was funded by the State Justice Institute. As Mark mentioned, they are the primary funder for this work. We initially engaged some jurisdictions across the country in targeted resource mapping, specifically to document existing services for substance abuse and substance use disorders for children and families. And during that process, each jurisdiction developed a small team of individuals. We documented existing services. We helped them plan on how to address the gaps in those services. Our resource map identified 5 columns, types of resources that are essential to an effective continuum of resources, and they match each of the 5 webinars. So when we started talking a little bit about what resources existed in this harm reduction space, for the jurisdictions we were involved in probably about 15. We found very limited resources existed in the jurisdictions that we were working with. Most jurisdictions had, that column was nearly blank when we were finished completing their map. And so that started at NCJFCJ, we started thinking about why that might be and how do we formulate a series of webinars around difficult conversations around each of these areas on that resource map. And there's no shortage of difficult conversations around targeted resource mapping. And so that's why we developed today's webinar and how it came to be. I want to talk just briefly a little bit about what harm reduction is as a philosophy and as an approach. In general terms, harm reduction is a set of practical strategies and ideas aimed at reducing the negative consequences associated with substance use. In many cases, organizations focus on stopping all drug use at all costs, where harm reduction philosophies seek to make change through policies and programs that acknowledge drug use while trying to reduce the harms that are associated with it, both at the individual and the public health level. Some strategies include safer use, managed use, abstinence, and meeting people who use drugs where they at. I think the harm reduction approach is the epitome of meeting individuals where they're at. Harm reduction approaches accept, for better or worse, that drug use is a part of the world and chooses to focus on minimizing its efforts rather than to ignore or condemn them. And I think, as I mentioned, there's no shortage of difficult conversations around harm reduction. We found that when we were engaging those jurisdictions in this resource mapping work, there just wasn't a whole lot there. And a lot of people felt that topic was controversial when we start talking about strategies like supervised use clinics or needle or syringe exchange programs, or policies or practices that help to identify ways to use drugs safer. There was no shortage of controversy around those topics. Harm reduction practices are much more common in the Eastern Europe, in the Netherlands, and the United Kingdom, but not so much here in the US. But when we think of harm reduction in the broader context of its use in other drugs, it seems to sort of lessen its controversy, so to speak, in terms of thinking of how nicotine patches or e-cigarettes are used to reduce the negative effects of first and secondhand tobacco smoke, or naltrexone to reduce the pleasurable effects of alcohol. So those are some harm reduction approaches that are used on other drugs that most people seem to understand and get behind. And so even in terms of alcohol, if we think about designated driver programs or those events around New Year's Eve where tow truck companies offer to provide towing, those are designed to reduce the negative and harmful effects of alcohol without stopping the entire use of alcohol. I wanted to engage our panelists a little bit in some discussion around, we recognize that harm reduction means different things to different people, and it certainly is based upon based upon your role in the system. And so we have a judge, we have a treatment provider, and we have probation represented on the panel. And so I'd like to start with a conversation about what does harm reduction mean to each of you based upon your role. And if we could start with Judge McGinnis, that'd be great.
Sure. So for me as a judge, I'm going to see people for the first time in the courtroom, basically. And if we take the example of a mother who's had their children removed, so we're in a first hearing for having the children removed because of her severe opioid use disorder, and we're trying to strategize how to move forward. Of course, I'm going to order her not to use any illegal drugs. But the reality is that she's not going to be able to stop using illegal drugs right away. And we're not going to punish her for not being able to stop using. And so we kick right into how are we going to get this person services. And if it is an opioid use disorder, the first thing we're going to want to do is to get her on medicine for addiction treatment, such as buprenorphine, which is our preferred starting place because that's been shown to be most effective. But, as we move forward to review hearings or discussing parenting time, we look at harm reduction. And harm reduction, as I mentioned, is really tied with being trauma informed. So when you're thinking about somebody who's coming with you who has an active substance use disorder, they're not going to be able to stop using right away. And we can't start punishing them or taking away parenting time just because they're showing up positive for a substance. So for us, if somebody is showing positive for opioids, as long as they're not impaired, we're not going to take away their parenting time because that is not harm reduction because that hurts the children. We want to maintain that strong bond. And we also know that if parents get time with their children, reunification is much more likely. So, that 3 times a week of parenting time is very key to having fast reunification for keeping the people motivated. And the other thing about harm reduction is that if a person is afraid to come to court to get tested because they think they're going to go to jail or they're going to be punished somehow if they turn up positive, that's not helpful because they're not going to show up again. And it's really important for us to not have judgment about their opioid use disorder, to not be judgmental that they're having it. As long as they're engaging in services, as long as there's forward movement, that's what we care about. And so we're not going to sanction somebody simply for returning to use. And as a judge, I have to balance when is it just a return to use or when is there something else that we need to act on, or is there danger to the children or detrimental to the children for them to have parenting time with this person. So harm reduction is very broad in my mind. It's anything that reduces harm to the community, to the individual, and to the family. And anything that we can do to reduce that harm, we do try to do.
Thank you. Jill, would you like to weigh in?
Sure. I'm going to really bounce off of what Judge said, and really at the basis of our focus there at the court is being trauma informed. And, you know, for us on the treatment side, that is really the core of what we're trying to do in addition to the harm reduction. It's, you know, the 5 key things for trauma and being trauma informed are folks feeling safe and that they can trust us. People feeling like they can collaborate in their process and treatment with the court and around choices that are made about them and their family and their treatment. And also, you know, feeling like they can, you know, have some empowerment in what happens with them throughout the process, that they can choose what's best for them in the treatment realm. So that starts for us right at screening and assessment. So being in a small tribal community, you know, the elements of safety and trust and confidentiality are so critical for people. We all know here and in many small communities, feeling like you can't trust someone when you're talking about your trauma history is increasing what I believe to be harm to them and their family. So really ensuring that from the assessment and screening phase that people do feel safe. They feel like they can come and speak with us about what's going on with them and them as parents or with their family. And also assessing where they are in their substance use and figuring out if there's willingness for them to try medicine for addiction treatment. And if they're not ready, like it says there in the second bulletin, meet them where they're at, see what other ways we can address their risk. And I think we all know, if we're not familiar with the ACEs, adverse childhood experiences, we know that an increased score on this 10 score question directly correlates with risk level. People at a 5 or more, their life expectancy is at least 20 years less than the general public. So we know a lot of their that can be like preventable. So we want to look at, you know, their medical, we want to do the biopsychosocial. So we want to look at their medical needs, their health needs, their mental health and substance use needs. So wherever we can meet the need and address risk and reduce that potential harm is where we're going to start with treatment, and then building treatment around where they're at and meeting their needs. And with a lot of that choice, collaboration, trust, and safety woven in.
Thanks, Jill. Dawn, would you like to chime in?
Sure. A lot of probation usually runs off of what the judge is giving us to utilize. So a lot of times what we do is we talk to them, we try and get them to understand that we don't want to send them to jail. We don't want them to get into trouble, but we also want them to work towards not using any kind of opioids. So we try and work with them to gain trust, and hopefully they're not going to try and cheat us. They're not going to try and cheat our tests. And they will figure out that if they just come in and say, hey, you know, I used last night, or I used something, you know, 2 days ago, that all we're going to do is send them back over to Jill's department and say, hey, they need something a little more than what they're getting right now because they're struggling. But our goal is really to gain that trust with them, and hopefully they also gain the respect that we're not going to just say, well, you know, you can't use, and if you do use, we're gonna send you to jail right now.
Thank you, Don. Judge McGinnis, I'm hoping I can ask you another question regarding something you brought up during your discussion around this notion of parenting and how drug use might affect parenting, your ability to be a good parent, and this notion of if it impairs your ability to parent, how do you make some of those decisions? How do you sort of discern whether the use of drugs is actually impairing their ability to be a good parent?
Well, I'm talking about the supervised parenting time when I'm in the, you know, that it's an that if the parent is impaired, like actually impaired by alcohol or other drugs, and that would be a decision by the person who's supervising the visit. But simply requiring parents to pass a drug test before every parenting time, if they're not impaired, there's no reason to not allow the parent to have parenting time simply because they used yesterday. If they used yesterday and they're not impaired today, there's no reason for them to not have their parenting time. So that's something that we don't do drug tests before parenting time. That's not something we do. We do an impairment check to make sure that they're not impaired by alcohol or illegal drugs, but you know, anyone can be trained to do the impairment check. In fact, almost everyone on the Pueblo has been trained to do that because that's what we have for our drug testing, that if somebody's impaired, then they may get drug tested. But that's what I was talking about in that sense.
Great, thank you. I think that's useful information for a lot of our participants today. I wanted to now turn to the audience, our participants that have joined us. We have a great group. Looks like we have over 150 people that have joined us this afternoon. Feel free to use the chat for this question. We're curious, are you using any harm reduction strategies or approaches in your court or community? So either some of the things that maybe our panelists have discussed already, things that you might be doing as well, or additional strategies or approaches that you might be used in your community or in your court. Feel free to type in the chat, and Mark, as well as other staff, will be monitoring the chat for us.
Yeah, it looks like Catherine Kornblum-Zell mentioned supervised visits, and as Judge McGinnis had talked about as well. Don't see anything else coming in so far. Also, Lindy Oaks says supportive program through our family drug treatment court, and more supervised visits, according to Peggy Van Sickle. So lots of supervised visits and family drug court, problem-solving court, and treatment and supervision through those courts. And I don't see anything else.
Yeah, those family drug courts are a great way to add a trauma-informed focus to treatment as well.
And Jamie Boatwright mentions they have a youth advocate program for positive mentoring. It's a good.
Great, thanks for everybody's input. We'll keep monitoring the chat there if additional strategies or approaches that you have are in the community. I'm now going to turn it over to Mark to facilitate our next question. Okay,
thank you. So now we're going to be talking about strategies to reduce harm reduction. We've talked about a few already, and also in relation to barriers. Barriers is a term we use a lot in treatment and intervention, and we're going to be talking about barriers in the child welfare and maybe even juvenile justice realm. So just a few background points. You know, as we think about mental health and addiction in general, we talk about stigma. So, and that includes for harm reduction, reducing stigma requires education and relationship building and collaboration in the community. Also, according to the Center for Rural Opioid Prevention, Treatment, and Recovery, they note that acknowledging and refusing to continue stigma and cultural norms that have left people isolated, alone, and ashamed. So it's more about inclusion. If what they say about the opposite of addiction is connection, then disconnection, as Judge McGinnis mentioned earlier, by you know, isolating people and pushing them out, it really does the opposite. It can't really work for somebody who's not around. So working through these myths and misconceptions is also critical. We're going to talk about some of that today. And then we can't really get through today without talking about how COVID and the pandemic has changed the landscape for treatment in general, but also harm reduction. And then what may come up also, we've noted is that to maybe distinguish between, harm reduction with young people and adults. So as we move into our primary question here is, how do you address barriers to utilize harm reduction in courts, including maybe dispelling some of those myths and misconceptions? So we're looking for those challenges that exist or arise in communities in implementing harm reduction, and talking about some of the barriers, maybe how to get past those barriers. So we'll start off with Judge McGinnis with this question as well. Judge.
Thanks, Mark. Yeah, I think for us, the way we overcame most of the barriers is that people saw that it was working. We started our adult wellness court that included parents who were struggling with substance use disorders in 2015. And, we've seen some remarkable successes. We have many community meetings, especially at the beginning, to explain medicine for addiction treatment, to explain what's going on in the brain of people who are struggling with substance use disorders, and why it's not a matter of willpower to just stop using, and people can't just stop using, and why it's so important to provide a non-judgmental space. And I know as a judge, it's funny to talk so much about being non-judgmental, but that's really key. If people feel judged, it's going to be really hard for them to get that trust that Jill was talking about. And it doesn't mean that I don't throw people in jail sometimes, of course. And it doesn't mean that I don't get mad at people, of course, because we're all human. But we also, have to examine our feelings towards the participants and our disappointments in the participants. And we do a lot of staffing to talk about that, so that we don't bring that to the participant, that we keep that amongst ourselves. And so we've done a lot of public education. We've done a lot of education around Narcan. We've done lots of training. Narcan is the naloxone that reverses opioid overdoses. So we've done massive trainings throughout the community to get people trained on how to use Narcan. And we actually keep a supply in the courthouse. And I have a supply on my bench that if I believe somebody might be in danger, or there's a family member there of somebody who might be in danger of overdosing, I just hand them Narcan and try to make sure that everyone has Narcan. That's it's a huge harm reduction. Narcan saves lives, and it has saved lots of lives on the Pueblo. Our police all carry Narcan, and they have done several overdose reversals. So results is really the best way to overcome the barriers, and education. And people still have a hard time with medicine for addiction treatment. They think it's a crutch. They think it's just another drug, that is just getting people addicted to another drug. So there's still a lot of that in the community. But once people see the results, we are able to overcome some of those objections. COVID has been difficult for all of us, of course, and it creates so much more isolation. So the small amount of time that we are able to have contact with our participants, it's so crucial to have a positive interaction with them. And that's the best way we can reduce harm, because they're very isolated. And, if they're not reaching out to their support systems, then the return to use is more likely to happen. And so, we try to keep the courthouses available as possible, but without, we have to be safe with COVID too. So it's a difficult situation, and hopefully it'll be better by the fall. But until then, we've seen, unfortunately, several deaths in the community, and from overdoses that may have been avoided had there not been so much isolation. So it's really important to keep all the channels open. And in order to keep the channels open, we have to make sure that we're creating a space that people feel safe to come to.
Thank you, Judge. Noting that the increase in overdose and drug use during the pandemic has been a factor. Another interesting concept is taking the judging out of being a judge. I like that, but balancing the accountability and the support. maybe just providing more support. So it's an interesting concept. Jill, how about you with regard to barriers to utilize harm reduction?
Yeah, and I think the things that Judge touched on are kind of our constant work on the treatment side too, which is really educating people and even loved ones of our participants who may be deciding to engage with some medicine for addiction treatment. A lot of times that stigma is there. It's just a lack of information or a lack of understanding of how beneficial it can be. So as Judge said, really promoting these things, educating the community and the families and other people in recovery. Sometimes we find that people who that doesn't happen to be something that they need, they can often need more education as well. So really promoting education around the effectiveness and for a lot of success that they find in using medicine-assisted treatment. And for us also on treatment, it's really figuring out what our local resources are for access. So once COVID happened, I think we went through a number of layers of figuring out, who is still seeing clients, who is still prescribing medicine, who can we access, because, the experiences of folks coming into our court didn't necessarily change. People still came in with the same needs, but a lot of things with COVID were changed or shifted. So using local resources, we have a program in the Pueblo that is a diversion program. So case managers and advocates who actually, if folks aren't involved in the court or they just want access to Narcan or information about needle exchange, we can direct them there. So relying on multiple different points of advocacy and case management within the community is helpful for addressing barriers. And also, I know Judge has done this for a number of years and just running the program. Like we've also looked at federal level resources for us. So we have a handful of grants through the Substance Abuse and Mental Health Services Association on a federal level. And just before COVID, I know Judge and I had applied for us to expand access for medicine for addiction treatment within our court, and we were awarded that grant. So that, broadly increases our access through funds and being able to hire more professionals to increase access. So those are some of the things that we're addressing here as far as on the treatment side for barriers.
Thank you, Jill. Yeah, it just shows the leadership of Judge McGinnis and just permeating the system, and not just the internal system, but also other agencies and the department, and also within the community, including other family members. So it's a good thing to note. And Dawn, how about you on barriers?
From the probation side, what we try and do is support everybody, because a lot of times our people are afraid to take medication because they do feel that it's just another crutch. It's just, so we try and get them to educate, and we try and help them to understand that it's just like taking a medication for diabetes or medication for high blood pressure. It's no different taking Suboxone or naltrexone or anything else if it helps them stabilize and become a balanced and productive individual. And that's what we're trying to do. We're trying to help them become a more positive role, have a more positive role in the community. And by helping them understand that the barrier is not quite so big and huge, that they can meet the goal that they're wanting. So, and we also encourage them. It's like, if you have drugs in your house, you have needles in your house that you need to get rid of, bring them to us. We'll dispose of them appropriately. And so this way, nobody's getting hurt. Nobody innocent is getting hurt by any of these these things that are just lying around the house that they might not know about.
Thank you, Jill. So it's about reduction in the harm and safety as well, and meeting people where they're at, as we said earlier. So I want to move to the next audience question, and also note that Michelle audibly noted child parent psychotherapy. That's something they do in their community. And Thomas Slagle mentioned that some, as indicated above, we utilize home-based mental health and infant mental health because substance abuse and mental health are often co-occurring, and they also use parenting coaches, so it's during supervised visitation. So those are good points from everyone. So what barriers in the community, what barriers have you encountered in adopting harm reduction approaches in your court or community? Participants, if you could just put those answers in the chat, and we'll note them. If you have any questions for our panelists, we can also note those. So we're looking for maybe things, funding, big barrier. Some if we don't have the money to supplement those things. Looking for support from a local, state, and federal level is huge, and really needed from all three, from the tribal and tribal communities. Stigma, overcoming stigma. Sherry Hartzler mentions that goes along with the education and changing the perception and the getting rid of the myths and the misconceptions. Transportation is huge, especially if and it might not be as many resources in rural or even tribal communities. Sometimes they have to go to other larger jurisdictions to and from drug screening and treatment. So, yeah, Tracy Bysinski. Lack of peer mentors. I think the whole notion of peer recovery and coaches is growing, but still need training and certification and supervision from the state and the community and the tribal. Lack of understanding at the DAs. The whole system is not often on board. If some aspect of the system is more punitive, as Dakota Whitlock mentions. And then Kathleen Macias mentions residential treatment or sober living environment, not wanting to serve clients receiving treatment from an MAT provider. And that's a huge one. And even sober houses and things like that, though, if you're going to receive federal money, you're going to have to abide by some of the more progressive philosophies. But there are some total abstinence-based community-based programs and treatment centers that don't really subscribe to harm reduction. So that would definitely be a barrier. Trying to find more foster families for children who are removed from the home. So that's always a concern. So Andrew, I'm going to turn it back over to you so we can finalize this third question here.
Thanks, Mark. And I think that it fits well when we just coming off the discussion around barriers, and we kind of hinted at this at the very end of the discussion about barriers, but talking about harm reduction and its use in juvenile and family courts. Courts aren't often well suited to adopt harm reduction approaches. They are often a zero-sum game. They're often based on abstinence and approaches, but we know that harm reduction approaches can help keep court-involved families together, as Jill and Judge and Dawn had mentioned, in terms of working with clients to keep them with their families. Harm reduction approaches can help build rapport and respects the dignity of individuals and the challenges that they face. So I wanted to talk a little bit with the panelists about, does the court have a role in developing harm reduction approaches to address substance use? And if so, what is it? How can the court be useful in this field? And we'll start with Judge McGinnis, if that's fine.
Sure, thanks, Andrew. The court always has a role. Judges, we're leaders in the community, we're leaders on the bench, we're leaders, of all the departments that come in front of us. And, somebody wrote that one of the barriers is the DA's attitude, and also I think you can add to that children's court attorneys' attitudes. But the judge gets to make the final decision, and the judge also gets to ask questions like, what harm is it to the child for the parent to see them if they're not impaired, if they simply have a positive drug screen? you know, what's the danger to the child if the parent goes on medicine for addiction treatment. You know, so the judge has a very strong role in creating the environment. So the next time the children's court attorney comes in, they know they're going to be asked that question. You know, they know that the judge is going to say, what's the danger? You know, how is this child in danger by having contact with the parent who's not impaired? And that's one of the main things that has changed a lot in the Pueblo community, the Pueblo Pewaukee community in the last 5 years, is that we've really changed how we do parenting time and changed reunification processes to happen as quickly as possible, as long as it's safe, because children need to be with their parents. And now the social services is prepared to come in and say, what's the danger to returning the child today? And if there is a danger, of course, I'm not going to return the child, or if the parent hasn't achieved stable sobriety. But, you know, if the parent's engaging in services, showing stable sobriety, then we start wondering what's the danger to the child. So I just saw there was a question about the impairment checklist, and I think you can just Google impairment checklist and it'll pop up with a screenshot of what that involves. And usually we have two people verify it. So they go through the impairment checklist and two people have to agree that the person is impaired, one of them being a supervisor. So the court as a center of all these people and developing policies maybe even just by questioning the children's court attorney or questioning the prosecutor about what's going on and why do we want to send somebody to jail just because they are exhibiting their chronic relapsing brain disorder by continuing to use, even if they're engaging in services. So, and asking, you know, what treatment response has happened, you know, why don't we try a treatment response first? So those are very key questions that need to be asked, and the judge has a key leadership role in that.
Great, thank you, Judge. I'm glad that you brought up the leadership role of the judge. The NCJFCJ has articulated for many years that the judges have a role both on and off the bench, and that leadership role extends to ensuring that there are adequate services available in the community to serve the needs of the children and family that come before the court. So thank you. Jill, would you like to weigh in terms of your role as a treatment provider, in terms of what your work can do to help address and develop harm reduction approaches?
Yeah, and I think we're going to be kind of a broken record as a team because we really do believe in harm reduction. And I think, you know, the whole model of a treatment court is to keep people in the community and give them what they need here, so that, you know, they're not separated from their families, they aren't, you know, incarcerated and not having access to treatment. And so us as the treatment side, we really do have a critical role in addressing stigma, which I know someone mentioned in the chat, and continuing to do work that is evidence-based and has been proven to be effective. For example, the combination of MAT services with, you know, evidence-based practices has been shown to increase success. So really, like, you know, being we're going to be really forward about these things in the community. I mean, I know that I talk about it with leadership here. I will talk about it with community members about that these are the approaches that we're taking as being trauma informed and being using harm reduction. And that includes, and I appreciate, I think Kathleen mentioned it, that, you know, if someone does need a higher level of care, that on our treatment side and as a team in the court, I know that we are always looking at the providers, you know, in residential who allow medicine assisted treatment, because often when we find that people aren't allowing that, they're not really looking at the current data and kind of really reinforcing some of the stigma around using medicine assisted treatment. So looking at it from, you know, the higher level of care all the way down to, you know, engaging people in treatment here in the home, with their families so that they're not removed. And I know Dawn oversees this and she can say a little bit more about it, but I think it's important that we also do offer sober living in the community. And I think that can be an important part of harm reduction, really also on the treatment side, because we know that someone is leaving our office and they do have a safe place to go after their appointments and things like that. So we are, along with the judge and probation and other leadership in the community, I think we have a really big role in developing harm reduction approaches on the treatment side.
Thank you, Jill. Dawn, did you want to add?
Sure. As Jill was saying, we do have a sober living apartment, and we create. Well, actually, Judge got that grant for me, and it's reassuring to know that theoretically people have a safe place to live where they don't need to worry about their family, because so many have family members who are also heavily into using drugs. So they now have a safe place to be where they don't have to worry about the peer pressure or the family pressure to use the drugs that they're trying so hard not to. So having that resource to help them reduce that harm is a major benefit to the community. It also helps. It also helps with reducing the criminal aspect of it, which is, to be honest, that's where probation has its core. We're trying to reduce recidivism. So it has its benefits in that, because you're helping people figure out that if they even learn a little bit of how they're thinking and how they want to change that thought, because we also, another reduction is going to a cognitive behavior class workbook, which is what we do, and them helping them learn even a little bit that, oh, I can change this behavior and I might still use, but I'm not using as much, or I'm not doing it as often. So it helps them to start building on that premise that, well, if I change this behavior, I can limit this, and if I change another behavior, then to a point where hopefully at some point they're not using anymore.
Great, thank you, Dawn. It's great to hear all of you weigh in on the role you each play and your respective agencies play in developing harm reduction approaches. We'd like to take the question to the audience again. What role can you play in developing or sustaining harm reduction strategies in your own communities? Feel free to, again, type in the chat. We'll be monitoring that chat for your responses. Curious to see how you may be able to move some of this work forward in your own communities, or what steps you might take to implement some harm reduction strategies that you may have heard about today.
Yeah, and while we're waiting, Thomas Slagle mentioned earlier, might not be something we can get into deeply, but it said the legalization of recreational marijuana and medical marijuana in his state have increased substance abuse, but it also decriminalized the behavior, which was a barrier reduction. So definitely different states, and I'm not sure how that speaks to the tribe what we're talking about today in different tribes, but maybe Judge McGinnis can talk about that. And then another question by Vanita Taylor is, do we need to have federal legislative change to let all judges ask what is the danger to the child, and also the creation of reasonable safety plans instead of boilerplate? I think our enhanced resource guidelines has some bench cards for judges with regard to whether this child can return to the home or return to the family, and some really good guidelines. If you haven't seen that, we can get that to you. Catherine Kornblum Zell, participating in collaboration, exploring, implementing best practices. And then here's a response here from Deronda Combs about whether the state, whether it's a state or a federal issue, and that's definitely, and we're talking also about tribes here today, so there's lots of complicating factors, and Virginia's code includes a best interest consideration for custody and visitation with specific factors that must be considered. What is the danger may not be a proper question for the states using that as a standard. So a little bit more about child welfare there. Anybody, I don't see any other responses to the question. I'm not sure if our, let's see, one says, let's see, okay, we can participate in family partnership meetings to help get safety plan design. So other people are interested in strategies for pregnant women. So those are definitely a difficult conversation we haven't really addressed too much today. So in our closing time here, Andrew, what?
Sure, I was just going to reference, I like the indication of just starting conversations. One of the chat messages was about just collaborating and having an initial conversation about, you know, what services are we using? How are we addressing the needs of individuals? A simple conversation can really get some motivation started.
Yep.
Speaking of, so we do have some other additional resources that we wanted to provide. A couple of these resources are links that will be in the chat that Stephanie will toss in the chat. The National Harm Reduction Coalition, which had the definition of harm reduction that I used in the beginning of the presentation, there's a link for their website. They also have a downloadable PDF of the 8 principles of harm reduction that I thought were really interesting and valuable to consider for courts. SAMHSA has a page on harm reduction as well, which that's a link that'll go in the chat. And lastly, the 4th resource is Minimizing Harm, Public Health and Justice System Responses to Drug Use and the Opioid Crisis. That's a publication by the Vera Institute, and so that should be downloadable using the in the chat window at the very bottom to download PDF files. Those are available there. But before we close, I'd like to give each of our panelists a minute or so to just wrap up final thoughts on harm reduction and its use. And we'll start with Judge McGinnis.
Thanks. Yeah, so the chat box brought up a lot of difficult issues that we struggle with. Pregnant women, huge struggle. My advice is not a whiff of judgment. That's you got to keep them coming back. And the marijuana question is huge, and we struggle with it constantly. But I have to say, if we have somebody who has an opioid use disorder or has a severe alcohol use disorder, and they stop using, but they're positive for THC, we do a little happy dance in the back of the courthouse because we'd much rather have them be on THC and then work with them from there. But, you know, and New Mexico does have medical marijuana, so we do recognize medical marijuana cards as long as the person isn't driving impaired. But there's a lot of discussion that could be going on. We could go on forever about those questions.
Thank you. Jill?
Yeah, final thoughts. I think, you know, what's important for us on the treatment side is just really knowing what your resources are in your community. Like I think the first slide, it's like really understanding what's available, and then educating yourself, having those resources on hand so that, for example, for Catherine's question about pregnant women, we're always looking for and build our list of resources for women to get on Subutex or residential treatment facilities that are focused on or prioritize women who are pregnant or have young children under the age of 5. So I think resources and education for the community, for the potential clients walking in the door, and really just for the staff. I mean, I think really educating everybody on trauma, on the resources that are available, such as medicine-assisted treatment, is really important, and just continuing to break down that stigma.
Thank you, Jill.
Mm-hmm.
And finally, Dawn.
I noticed a lot of people were commenting about transportation issues. We have major transportation issues here, and to help with harm reduction, a lot of times probation needs to be a little more understanding and tell people to get here, as soon as you can. We'll give you until 5 o'clock. We'll give you until, whatever time somebody is here. But I think that understanding and trying to help people reduce their stress in meeting their goals and meeting the needs of the court helps also to reduce their harm reduction, to help them not go out and use.
Thank you, Dawn. And just lastly, I know a couple of housekeeping items. We do have a survey for the evaluation of today's webinar that we will put in the chat box so that you can evaluate today's webinar. If you take a minute or so to do that, that would be great. Number two, if you need a certificate of attendance for for participating in today's webinar, you can email our administrative assistant, Lori Pumphrey. Her email address should also be in the chat box. So you can email her to get access to a certificate, a blanket certificate of joining today's webinar. And lastly, thanks to our panelists for joining us this afternoon to have these conversations around harm reduction. And lastly, thank you to all the participants, over 150 folks that joined us today, and all the work that they do on behalf of children and families in their own jurisdictions. So thank you very much and have a wonderful day.